Hello everyone, my name is Karim Hani, and along with my partner Osman Al Mubarak, we're presenting our literature review, the relationship between Alzheimer's and oral health. In the beginning, we'll be talking about some introduction, background information, and then we'll move into aims and objectives, the materials and methods, and then eventually we'll reach the conclusion and some of the recommendations that came out of this research. Now, first off, to define what Alzheimer's is, it's a progressive degenerative disease of the brain that leads to dementia. It causes significant loss of intellectual abilities, such as memory capacity, that is severe enough to interfere with social or occupational functioning. Most patients will need aid to manage and go through their life. The estimated prevalence of dementia is around 37 million people worldwide, and by 2050, it is estimated that every person in 85 will suffer from dementia. Now, to define what periodontal diseases are, they are a set of inflammatory conditions that are caused by bacterial infections. In the early stages, they are called gingivitis, which is characterized by redness and bleeding on probing. And on the later stages, it is called periodontitis, which is loss of attachment between the bone and the tooth. Most teeth become mobile, and some of them eventually need extraction. Now, why do we care about the relationship to Alzheimer's? As oral diseases can lead to systemic diseases, and vice versa, systemic diseases can show their first symptoms in the oral cavity. And as dentists are more exposed to this, they are very important in the early detection of some of the systemic diseases. Other chronic inflammatory diseases and the relationship to periodontitis has been established, such as atherosclerosis, cardiovascular disease, and rheumatoid arthritis. Now, peripheral inflammation in response to infections, including periodontitis, play a role in the pathogenesis of Alzheimer's. Chronic inflammation is regarded as a common denominator factor of both periodontal diseases and neuroinflammatory diseases. Periodontal diseases evoke a low-grade systemic inflammation through the release of cytokines and pro-inflammatory agents such as interleukin-1, tumor necrosis factor alpha, and interleukin-6. Now, there are three mechanisms by which periodontitis can cause this neuroinflammation. One, pro-inflammatory cytokines, they can go through to the brain by neural pathway, humoral pathway, or cellular pathway, or direct invasion of bacteria and bacteria byproducts into the brain through the bloodstream or cranial nerves, or through the leptomeninges, which has a communication between the bacterial molecules and the neural cells. Other neuroinflammatory diseases that are suspected to be in relation with periodontal disease are major depression, Parkinson's, and schizophrenia. In Alzheimer's disease patients, there are noticeable increase in plasma antibodies against periodontal pathogens such as P. gingivalis, which the serological marker of periodontitis serum was associated with poor logical verbal memory. P. gingivalis was also detected in the postmortem brain tissue of Alzheimer's disease patients. There is an indication that tooth loss as a consequence of periodontitis is also associated with increased risk of developing dementia. Now, as our aims and objectives of the study are to describe the relationship between oral health and Alzheimer's disease and educate the dentists about the correlation to relate to their patients. And now my partner Osman will complete that.
Thank you so much, Karim. So moving on, we go to materials and methods. First here, we have the attached ethical approval we needed for this research. Next, we have the inclusion and exclusion criteria. The inclusion criteria were basically articles published between 2010 and 2020. Epidemiological research studies, literature reviews, and clinical studies were all included. However, articles posted before 2010, articles that were not in English, editorials, letter to editors, and short communications were all excluded. Here we have the PRISMA 2020 flow diagram. As you can see, we've screened around 1900 records for our research. However, upon further research, 16 only were sought out for retrieval. And out of the 16, 2 were excluded regarding that they were older than 1990 or letter to editors. Moving on, we have the results table. The first study failed to confirm significance of the relationship of peripheral inflammation, while the second study showed that the periodontitis associated with dementia is relevant after accounting lifestyle changes. The third study showed that neuroinflammation was found to be the key pathological connection between periodontal disease and neuropsychiatric disorders. The next page, the first study showed that the peripheral inflammation and loss of dental elements had significant role in the pathogenesis of Alzheimer's disease. The second study showed neurodegradation after the application of P. gingivalis. And the third study indicated that oral infection of P. gingivalis can be an initiator of development of neuropathology consistent with that of Alzheimer's disease. Now, next page, the first study showed that Alzheimer's disease is mediated by host inflammatory response. The second study showed that local production of antibodies in the cerebrospinal fluid was directed against periodontal pathogens, but could not find an association with Alzheimer's disease. The third study showed that the oral cavity could be an important source of biomarkers of Alzheimer's disease. The fourth study mentioned that available evidence did suggest a positive trend towards an association between periodontitis and dementia. And for our last page of results, the first study did not find a clear relationship between the severity of dementia and degree of periodontitis. The second study mentioned that the negative effect of periodontitis on the CNS may be more pertained to cognitive impairment in attention and memory rather than in reaction time. The third study established a significant association between tooth loss and cognitive impairment. And the last study showed that peripheral immunoactivation induced by systemic challenge can activate immunological response in the brain. So what was the discussion after doing this research? One study done by Laugusich suggested that a local production of antibodies in the CSF directed against P-gingivalis and other related periodontal pathogens may occur in patients with dementia, but there was no association with Alzheimer's disease. In this study, however, it was noted that only patients under the 70 years of age were included, meaning most of them had an early onset of Alzheimer's disease, which is defined when it affects people below the age of 65. And it is discussed to be primarily associated with genetic risk factors. This is in contrast to late onset of the disease, where inflammation and infection might be of more importance. This may have impacted the findings of this study. Another multiple studies done by Elivesky, Diogardi, Hashioka, and Choi all concluded relation between cognitive impairment and periodontitis through inflammation. In contrast, a study done by Gil Montoya was unable to confirm its relevant role in the etiology in cognitive impairment, although they show in the research increased systematic inflammatory biomarkers related to periodontitis. So what is the conclusion? Although evidence suggests correlation between periodontal health status of the patient and the progression and aggravation of Alzheimer's disease and dementia, researchers failed to conclude the extent of the effect of the periodontal status of patients on the development of neuroinflammatory diseases. It also showed that one of the reasons for the difficulty of proving this correlation is multiple studies suggested other confounding factors, age, martial status, socioeconomic status, all being examples of it, which could play a role in this relationship, while another reason could be the difficulty to follow up with patients suffering from Alzheimer's disease. So what is our recommendation, me and Dr. Karim personally, after doing the study? Our first recommendation is that more extensive clinical studies in different parts of the world should be done to assess different races, ethnicities, and take into consideration further risk factors such as diet, smoking, and systemic diseases. We also recommend raising awareness among dentists about managing cases related to dementia medication and dementia patients in general. The dental treatment for patients with dementia should be based on the dentist's clinical judgment, as well as the input of the patient, if possible, or their family. And we generally advise all healthcare workers, professionals should raise awareness about the possibility of chronic periodontitis being a risk factor to dementia. We would like to express our heartfelt gratitude to our supervisors, Dr. Hala and Dr. Huda, and we would like to extend our thanks to our respected Dean, Dr. Mustahsan, for his wise leadership. These are our references we use for this research. Thank you and have a nice day.